10:51, and time for News Extra, brought to you by Pinnacle Bank, Torrington and Mitchell, the way banking should be. Here is Kevin Mooney.
Thank you very much, Dennis. Good morning, everyone. Our guest today on News Extra is Diana.Rohrick. She is Director of Home Care and Hospice up at Regional West Medical Center. And this is Home Care and Hospice Month, November, so that's why we have her in to kind of tell us about some of the things the hospital offers. And you guys have expanded services tremendously recently, right? You were serving 7 counties, and you're now serving how many?
19, Kevin.
Wow, that's fantastic. So what was the reason why for the big increase? Basically, you guys were obviously the best provider, right?
Well, I think Regional West saw the need in the Panhandle. We have a few home cares and hospices in the Panhandle of Nebraska, but they're very few and far between. And there's lots of areas that are not covered. So Regional West has been very supportive in allowing me to expand home care and hospice into 19 counties.
All right. And so the workers, are they based here? You have 28 people that work in the home care and hospice area, and then they expand out into those areas?
Right. Actually, the people that are here just cover this area.
Okay.
And then we have drop sites, and that's a CMS term, the Centers for Medicare and Medicaid government. They have designated these as drop sites. So we have the parent agency here in Scotts Bluff. That's where the administration is. That's where we do all the billing and the QA and everything that is the background for home care and hospice. But the real care is done by the people in the communities themselves. And that's what makes it work.
Yeah. So if somebody needs home care, say, for example, like I took advantage of your home care right after my heart surgery, and had somebody came into the home, and once a week, I think maybe even at the very start, a couple times a week, and just checked on me, took my blood pressure, took all my vital signs to make sure everything was going okay. That's the type of thing you guys offer, right?
Right, and so much more. We do wound care, we do infusion therapy, antibiotic therapy, any kind of skilled care that an RN can do within their scope of practice, and any of the therapies, because we're a full-service agency.
Yeah, so it works out really well. You make the call, make the appointments. They show up at the appointed time, take care of you, and then they're off. How many visits does a normal therapist or person do in a day's time if they're doing home care?
You know, I think that's what makes it very special. It's based on the patient's needs. It would be very easy to have a set number of things that we do, but it all depends on what each individual patient needs.
Yeah, and it's all covered normally by insurance for the most part, right?
For the most part, yes.
For the most part. Usually the patient will probably have to pay some kind of copay, I'm sure, for the visits, right?
Sometimes,
I'm trying to remember.
Sometimes, but after they've been in the hospital, usually that's covered. So
Yeah, that's true, because you probably met your deductible by then, right?
And they don't if they're a Medicare patient or Medicaid.
Okay. So you guys have been doing this since 1967.
Kevin, we were the first agency in the state of Nebraska once Medicare said that they would pay for it.
Yeah. So that's great. Huh?
Yeah, it is.
It's fantastic. So we're going to talk a little bit more especially about the hospice end right after this.
Secure your peace of mind with Pinnacle Bank's new checking account, the Diamond Secure account. With it, you'll get all the great features of our checking accounts, along with identity theft protection and cellular telephone protection. For complete details of this checking account, speak with the bank representative. Open a new Diamond Secure account in branch or at wypinbank.com. To switch your current checking account, visit your local branch in Mitchell or Torrington. Pinnacle Bank, member FDIC. Insurance products are not insured by FDIC or any federal government agency. Not a deposit of or guaranteed by the bank or any bank affiliate.
We're back on News Extra today. We're talking about home care and hospice provided by Regional West Medical Center. This is Home Care and Hospice Month around the nation and around the state. We've talked about the home care end here in the first session before the break. And Diana.Rohrick is here. Now we're going to talk about the hospice end. And tell us what the hospice is all about.
Hospice involves care at the end of life, and I think our whole purpose is to make sure that those last few days, weeks, or months are met with the very best care and the very best quality of life that we can bring to those people.
Yeah. Now, you have a hospice area at Regional West, right? How many beds?
We don't have an inpatient anymore.
Oh, you don't?
We are
Okay.
in the home, and we do hospice in facilities, in nursing homes. We can have patients in the hospital under general inpatient and respite, but that's infrequently now, usually.
Yeah. Okay. So you're out and about in the nursing homes.
We are.
And in the homes and so forth. And what type of things do you provide with hospice? Spiritual help, physical help, mental help?
I think you've just hit the nail on the head, Kevin. We cover the whole patient, and we also not only take care of the patient, but we take care of the family. There are needs that patients have at the end of life that they don't have at any other time. And you're right, the spiritual needs, the social work needs, the family needs, all of those things take precedence and really become very important to us in caring for the patient.
Try to alleviate any pain, symptoms, suffering
Absolutely.
as much as possible of the patient, right?
No one does pain management better than hospice nurses.
Okay. Now, hospice is covered most of the time by Medicare Part A, right?
Correct?
And so most people really...
And insurances.
And insurance. Mm-hmm. So most of that is covered. Mm-hmm. So, which is good. So it kind of relieves the thought about how much is this costing us, right, when you're in there?
Exactly.
Okay.
Exactly.
All right. Very good. So if folks want to get more information on either one of these services that you guys provide, they just give you a call, tell us your number and maybe your email.
Okay. They can call 308-630-1430, or they can email me at Diana.Rohrick at rwhs.org.
There we go. It's pretty simple. Diana.Rohrick at rwhs.org. And you can get a hold of her, and she can definitely answer questions. You can look it up in the phone book. It's right there under Regional West Health Services. All right, very good. Thanks again for coming in.
And thank you, Kevin, for having me.
You bet, no problem. Diana.Rohrick today talking about home care and a hospice over at Regional West Medical Center.